Hello, team, and I would like to thank you for joining me on this manager change brief. Within this brief, we are going to discuss an error that has been found out within our operations and how we are planning on fixing it. I would definitely like your feedback on this presentation because after it, I will also be briefing your staff. Due to your time being valuable, I would like to run over the agenda real quick before we begin. So we'll start with the introduction. I'll discuss the internal problems that were found. I'll do a refresher on the stakeholders. I'll discuss the execution plan, and then I'll sum it all up. Lastly, I'll open the floor for any questions or feedback that you may have. So why are we here today? Well, in 2010, a newspaper article was released talking about hospitals and their operations. Within that article, it discussed that after a 10-year effort to reduce errors, hospitals failed around the world. On top of that, hospitals failed to adequately treat patients. And lastly, patients acquired injuries while being treated by medical staff. As you know, this is a major problem, especially for an industry such as ours. Here at Springfield General Hospital, our number one problem is medication errors. Specifically, prescribing errors, inability to distinguish prescription with similar names, inadequate attention to the synergetic effects of multiple drugs and or allergies. As you all are aware, medication complications can be deadly. Fortunately for us, it has not come to that just yet. However, we do need to fix the problem right now. All three of the previously listed issues are lumped together under the label adverse drug event, and it has been the cause for over 7,700,000 patients being either harmed or killed throughout the United States annually. Know your stakeholders. As I'm sure all of you are well aware of the stakeholders, I would still like to discuss it. Within the healthcare structure, we have many stakeholders, such as the patients, government, you, the department managers, your staff, contractors, insurance companies, and the pharmaceutical firms, all of which have some type of involvement with the healthcare system and would be substantially affected by significant changes to the system. So, as managers, I am asking you to take the reins on your department and assist your staff with the change process. By your involvement, we can minimize the effect the changes have on the stakeholders and hopefully nix any stoppage in operations. Like I previously stated, you all, every single one of you, are the ones who can help the change process run smoothly. We can implement it, we can drive it down, but you all are the ones that's going to be there day to day answering your staff's questions. So here's how we're going to do it. Due to the problem revolving around medicine errors, we have decided to implement a computerized physician order entry, aka CPOE. I know for some of you you're not tech savvy. I understand that. However, it is imperative you understand at least the basics to help and guide your staff with its usage. So here is how the CPOE will work. The first step will be the physician prescribes the medicine and treatment into the system's database. Then the computer entry would be available to all the staff, including both the treatment staff and the pharmaceutical staff. Following that, the system would then review all of the prescription for errors such as incorrect dosages, duplicate requisitions, patient allergies, and even adverse impact statements of multiple medications being prescribed to the same patient. Lastly, the system will also display the patient's complete medical history, as well as the latest clinical guidelines for treatment. That way, we remove any confusion or any I don't knows. So now let me sum it up. So the first thing I would like to take away from this is that hospitals in the U.S. have failed their patients due to various reasons. For us, it was we handled medication disbursement poorly, adding to the problem of more than 7,700,000 patients either being injured or dying annually in the U.S. That is why we are adopting the computerized physician order entry, aka CPOE. This will make our hospital more efficient with dispersing the most adequate information and medication to the patients while decreasing the probability for adverse drug events. And lastly, the transition success depends on you. Like I have stated before and I have stated in other presentations, you are the department managers and you can minimize the effect the changes may have on our stakeholders and hopefully nix any stoppage in operations. So at this time, I will open the floor to any questions you may have. And if there are no questions, I hope you enjoyed this presentation and I hope it was not too hard on you. And have a great day.